Hey, I'm Dr. Mitzi, a board-certified neurologist and fellowship-trained neuroimmunologist, and this is Brain Chat with the Nerdy Neurologist. If you've ever left a doctor's appointment with more questions than answers, if brain health feels complicated, overwhelming, or full of medical jargon, or if you're just living with a neurologic condition and want more information that actually makes sense, you'll hear conversations with experts, clinicians, and people with lived experience in a way that's clear, practical, and human. No lectures, no fear-based information. So whether you're a patient, a care partner, or just a little brain curious, welcome to Brain Chat, and most importantly, let's get nerdy. Welcome back to Brain Chat. I'm Dr. Mitzi, and today we're talking about a topic that is extremely important whether you go to the doctor once a year or whether you go every month, and that is communication with your healthcare team. Whether it's feeling rushed during those appointments, not knowing what questions to ask, or leaving an appointment and realizing you forgot something extremely important, that communication with your team can sometimes affect your outcomes just as much or more than your medications do. And today I've got two amazing guests who are going to break this all the way down so we can get that communication together. All right. We've got Dr. Jakai McEwen, who is a board certified neurologist, fellowship trained neuroimmunologist, and neurologist at Joy Life Wellness Group in Atlanta, Georgia. And we have Dr. Charnetta Colton-Poole, who's a board certified pediatrician, author, and communication strategist. Welcome back to Brain Chat, ladies.
Thank you.
Thank you.
All right, so let's get into it, right? So this is a really important topic because a lot of times people say, there is a breakdown of communication with their healthcare team, and that either causes them to maybe leave that doctor's office or sometimes leave the healthcare system entirely until something more severe happens. So we want to make sure that people are able to keep that communication open so that they can continue to have the best outcome. So I'll start with you, Dr. Poole. When you think about communication in healthcare, what problems do you see most often from your side of the exam room?
Oh, wow. That's a great and loaded question. Because at the end of the day, patients and doctors, we don't speak the same language.
Right.
Our understanding of kind of how the visit works and what needs to happen, there's checklists, there is there's a method, there's a time frame. Mm-hmm. And for the patient, it's about their lived experience. It's about their stories. They don't quite know kind of the ins and outs and also those time restraints that really minimize us being able to handle everything they've ever been through in life. Mm-hmm. And so I think the biggest issue is getting on the same page and mm-hmm. speaking the same language, which takes help on both ends.
Mm-hmm. So I think that that's extremely important because oftentimes the doctors and the patients, we each have our own agenda. So when you go to the doctor, your doctor has things that they want to cover and you have things that you may want to cover. But if those thoughts are not organized or you don't have them written down, often your agenda may get overlooked. So one of the most important things we want to do is make sure that your agenda gets addressed so that you get the most out of your appointments. So when we think about communication, and we know that it plays such a big role in health outcomes, why can communication break down even if the care is excellent? You may be going to the top physician, you may be going to the top research center, but that communication can still be an issue. Tell us why that happens.
Well, if you think about it statistically, like over 30% of adverse events are due to miscommunication, even mm-hmm. in the best of situations and circumstances.
Mm-hmm. So an adverse event meaning something bad that happens,
a bad outcome,
either from a medication or from a procedure or something else,
or from lack of communication, or the perception of lack of communication. Because if the patient perceives that you did not listen and you've given them a plan, they won't follow the plan. Mm-hmm. And so sometimes it's not even that the communication is bad, it's the perception mm-hmm. of lack of communication or lack of time spent. And when people feel discarded and thrown away, they don't follow orders, and mm-hmm. therefore you have a bad outcome. Mm-hmm. The other thing, when you think about the way our health system works, you have all these specialists, and oftentimes if you have like chronic illness, you may be going to several different doctors, and one may be a surgeon and one may be an internist, and that communication can be splayed as well. And oftentimes you're going to the surgeon and they just looked at your chart 5 minutes ago. And so you're thinking they are like heaven. They're going to be the answer to every question you've ever had. And they're like, let me look through your chart real quick. Like they are not as invested at that time because they don't really know what's going on. And it's kind of like routine for them. And so I really think that regardless of how excellent the physician is, there can be huge breakdowns in communication that can alter the outcome just because of things that are said improperly, things that aren't said, or just that mismatch of what you understand and know and then what's actually said.
So it sounds like communication can be really complex. So we not only have the communication between the person with the, issue or that's coming to the doctor, we have that communication between them and the healthcare provider, but we also have the communication between different healthcare providers if we have a medical condition that's complex or chronic. If that communication is not good, then sometimes people feel like they get bounced around. So, one doctor will say, well, this is not my problem. This is the other doctor's problem. And then you'll go to that doctor and they say the opposite thing. And so it's really important. And Dr. Charnetta touched on it a little bit, but I want you, Dr. McEwen, to tell us a little bit more about what happens when that patient feels unheard or unseen in that appointment.
A lot of times we'll see that patients will actually shut down, and that affects the relationship that they have with their provider. So they may just go to their appointments just to go, and they leave, with the understanding that they're not listening to me anyway. I'm just going because I needed to show up. I need a refill for my medication, but I know I'm going to go look on Google to figure out the answer that I really need. So there, a breakdown of communication, I feel like, happens sometimes in cases like that. Also, I think specifically with neurology, from our standpoint, we also have to realize that there are a lot of big words that we use, and we all, even as neurologists, we pronounce things differently. And so we have to realize that our patients don't always understand some of the things that we're saying. And so we have to take a step back to say, okay, let me meet my patient where they are. And if I have my normal spiel, I might need to break it down even further if I see my patient kind of zoning out because they don't understand what I'm saying.
So I love what you said about it's important for the doctor or healthcare provider to also look at the person in front of them. And if there's indications that either it seems like they may not understand or maybe they're not paying attention, we can ask those clarifying questions like, can you say back to me what we just talked about? Or tell me what, you don't understand. Or sometimes I'll go into a visit with an open-ended question and say, how can I help you today to make sure that I'm addressing the agenda that the person has? And I think it's also important as healthcare providers that we remember that sometimes when we say that people are non-compliant, right? And non-compliant is a big word for you ain't doing what you're supposed to do. Sometimes it's because that communication is not good. And so people are like, well, why should I go back to the doctor? Absolutely. Because they don't listen to me anyway. They don't understand. They may not take their medications because they don't understand what they're for. So that communication goes both ways. So for you, Dr. Poole, from a communication standpoint, what makes medical conversations especially challenging?
Well, alluding to what you've all said, the language, right? And so oftentimes as physicians, we may just be speaking and saying things that our patients don't understand. And out of respect and even sometimes intimidation, they don't say anything. They won't stop you and say, I don't understand what you're talking about. So that definitely makes communication challenging. The other thing is the health literacy rate in America is very low. And so it's like more than half of Americans are health illiterate, meaning they don't have an understanding of what we are saying. And because this is so routine for us as physicians and other providers, sometimes we don't even realize, to your point, that we're speaking above their head. And sometimes the patient does not give you any indication that you're doing so either. And so to your point, Dr. Mitzi, about really reflecting, oftentimes I will have a patient say, now tell me that back. What did I explain to you? How do you understand what I've said to you, to make sure they have an understanding? And they really appreciate it because it's their opportunity to say, I really don't get it, or this is what I think you said. And then that way you can make sure that they have understanding. But it's hard. We're speaking a different language, and it's okay. That gap can be bridged, but you just have to be aware of that. And I think to your point also, just have your agenda and make sure you get your concerns and questions out there.
So I like to make it plain. And one of the things that I've learned over, nearly 20 years of practice is that whenever I meet somebody new, I always start at the beginning. So even if someone comes into me and let's say they've had MS for 20 years, my first question is, tell me what you understand about MS. And so that opens the door for them to be able to say, you know what, I've had it all this time. I've been to 20 doctors and I really still don't understand, right? So it gives that opportunity for them to say whether they do or don't understand and open that door for you to explain. So I try not to assume that everybody knows what I'm talking about just because they have been around the block for a little bit and maybe been to several specialists. They still may not get it. So I think that that's something that we as healthcare providers need to do, is make sure that we open that door to say, you know what, I'm not going to assume that you understand everything. You may. I got some people that give better words than me, right? But at least it gets us to speaking the same language, and I know where you are so I can know where to meet you. So what are the most common communication challenges that patients bring into appointments, Dr. McEwen?
I think one of the main ones is a lot of times at the end of the appointment, they'll say to me, this is the first time I've actually ever felt heard. You know, you listened to me, you didn't interject. You included me in the conversation and the plan that we had. So I think that's one of the major things that I hear pretty frequently.
And one thing that we really try to do is what we call shared decision making. So, you know, back in the day, we used to call medicine paternal, right? So that means that you go to the doctor and the doctor tells you what to do and you're supposed to go home and do it. But shared decision making really recognizes that the person living with the condition is an important or the most important part of the healthcare team. So we sit down, we talk about things. Often we'll talk about, you know, when we're making decisions about treatment, I will give someone several choices. I'll explain it. I do all kind of horrible drawings and rap analogies and all that stuff to try to make it plain. And then I'll let them go home, talk to their family about it. And then we come back and make a decision, right? So that shared decision making is really what we're aiming for, where we are partners in that decision. And if we're partners and you have some buy-in, then it's going to be a little different if you don't do it, because it's what you agreed to, right? And so I think that's really important for us to emphasize. So in neurology specifically, where do you see communication breaking down most often?
Most often I see communication breaking down with overall knowledge or awareness of maybe their diagnosis. So for those that are tuning in today and are not familiar, I myself have multiple sclerosis and often think back to when I was diagnosed. At that appointment, thank goodness my parents were with me, but when I was being told that I had MS, the conversation in my mind was, okay, well, what does this mean for me? Am I going to be able to become a doctor? That was my first question to the neurologist was, will I be able to move forward and go to medical school? Him explaining everything to me went in one ear and out the other. Thank goodness my mom was there to ask questions. Well, what is MS? You know, what does this look like for her going forward in regard to medications? So realizing that sometimes, especially when we're diagnosing, in that moment, our patients, they may not fully be there. They're listening to what we're saying, but they don't understand. So I love what you said earlier about coming back the next visit and saying, okay, what did you take from our first visit together? What did you understand about what is this diagnosis or what our treatment plan is going forward?
So really important, right? I think it's important to let things marinate a little bit, you know, because when it can marinate, then you really know what's going on. So I'm going to come back to you, Dr. Poole. What does good preparation for an appointment actually look like? So we're telling people, prepare for your appointment, have your agenda. What does that look like in real life?
So for the patient to be prepared for an appointment, you need to understand what you aim to get out of the appointment, because the doctor knows what they want to get out of the appointment. And it should be the same, right? So if you have specific questions and concerns, you have to write them down and write them down in order of priority, okay? Because we can't address 10 different things.
Right. If you got 30 things on your list, we're not going to be able to get to all 30.
We can't address that.
We need top 2, top 3.
Yes.
Okay.
So your top 2 to 3 concerns, write them down. But in writing them down, you need to understand those concerns as well. So if it takes you 30 minutes to explain the concern to the physician, you're just not going to be able to receive the like a great plan and education surrounding it, because we've run out of time. And so know your priorities and then write down the important points about those things, because sometimes when you get to the doctor, it's kind of a lot going on and you don't want to forget things. So to prepare for an appointment, number 1, know your priorities. Number 2, know your medications and your diagnoses, right? I know that, your doctor's supposed to have it on file, but we don't always know. And you should know your own medical history. And so you need to know what you take and why. You need to know if any of those medications have been causing you to have any changes in the way you feel. So you need to be able to express that. And then you need to let the doctor know when you get there what those concerns are at the beginning of the appointment. So for me, when I see patients, especially for well child checks, I always say, do you have any concerns? That's the first question that I ask, because it will shape how I guide the rest of the exam. And so, do you have any concerns? And they will say, yes, I have these 2 or 3 things. I will write them down. And as I'm addressing the normal things that I have to go through during a well child exam, I will put those things inside, and I will make sure that I'm dealing with those concerns. And so you need to make sure you speak it at the beginning of the visit, not at the end. And I call it the doorknob conversation.
Ooh. Now let me tell you what gets me. We've been sitting there talking an hour. You told me life is great. You told me you went on vacation. You said nothing was wrong. And I put my hand on that doorknob. And you say, by the way, my eyeball fell out last week.
Yes,
and I'm like, what? Like, we should have been talking about your eyeball. So yes, absolutely. So, when the doctor asks, how are you doing? That is the time to then let those concerns be known. Don't just say okay as a reflex, right? Because if you say okay, then we're going to keep going. And then by the end, your concerns are not going to be addressed, because we do have other people that we need to see, and we can't spend sometimes another hour with you to go through that concern that you didn't tell us about at the beginning. So I love that, Dr. Poole.
And then interject too.
Absolutely.
I think that we can also help to facilitate that. So one thing that I often like to do is start off the appointment with saying, I would like to talk about, what are your goals of care? What goals do you have? What matters the most to you? So we can also bring it up ourselves to kind of help guide the conversation.
Yes.
We have to take charge sometimes.
That's right.
Absolutely, because we can go on a tangent. But, the other piece is that we realize that Brain Chat is all about empowerment and education. And so obviously many of the people that come onto Brain Chat have kind of very similar thinking and ways of practice. But when you're in the community, you may not have a doctor that asks you those questions. So that's why it's so important to advocate for yourself, have those things written down that are your top concerns, and think about what's going on with you before you get there. Because if you say, Dr. Mitzi, I got a pain, and I say, well, where is it? And you're like, I hadn't really thought about it. And I was like, what does it feel like? Right? So try to think about those things and categorize them as much as possible before you get to that visit, because it will help us and help your team be better able to help you. So once the visit starts, what helps communication go well in real time?
So I'm a pediatrician, and I often joke that one of the reasons I chose pediatrics is because my patients don't have a long life story.
They sure don't.
And because I don't want to hear it. No offense, right? Because I will daydream and get off track, right? And so oftentimes I remember when I was in medical school, this lady came, she was like 85, she was precious, she got dressed up for her like yearly appointment, and by the time she hit that line, and then in 1950 I almost passed out because I can't take that. And so oftentimes if you're giving us your life story, we're going to get off track.
We need Cliff Notes.
We need the Cliff Notes. And so I think it is so important during the visit to try to stay on track. It doesn't mean that you can't speak up. You certainly should interject if you don't understand something or if you need clarity about something. But just try to stay on topic, because you can get off topic. We do in everyday life, but that is not the time, because those moments are precious. And we're there to heal you. We're there to make you better. And we want to be able to do that by staying on track.
Absolutely. And what phrases or questions from patients really help you understand what matters most to them?
Oftentimes, if someone will repeat themselves, like in the beginning of the appointment, they'll bring up a topic and then they bring it up later, or they'll say, this is really bothersome for me, or this keeps happening, or this is new, I don't understand what this means to me. Those are some cue words, I guess, or key terms that make me kind of cue in to say, okay, maybe I should ask more questions about this.
And I'll have you answer that question as well, Dr. Charnetta.
Can you repeat the question?
Absolutely. So what phrases or questions from patients really help you understand what matters most to them?
Okay, thank you. I really do think repetition is important. So when they keep saying the same thing, it's definitely important. Also, what they lead with, and then what happens after an uncomfortable silence, right? So especially with a lot of my teen patients, if I'm asking certain questions, there's always this awkward silence. What happens next is what matters. And so I'm just very in tune. I really try to stay in tune with my patients, the body language, their facial expressions, because it's more than about what they say. It's about those subtle changes in their language and their tone. So we can't always be looking down at our electronic medical record. We got to look at the patient. And then you can sometimes see those subtle changes and you can hear it, especially after those silences.
I like that. So waiting to see what happens after the pause. I like that. What should patients do after an appointment? So let's say they don't go to someone who's emotionally in tune, right? Because as we said, Brain Chat is a special place, and we all often speak the same language. So what happens if someone goes to that appointment and after they leave, something doesn't make sense or the plans change?
I think especially a lot of practices will have medical records where you can send in questions that you have. You can even send in, if you went to get a test somewhere else, you can send your results there. So making use of the chart to send in questions, and also not waiting until the next appointment. If something comes up, maybe your appointment is in 3 months, but a month after your appointment, you have new symptoms or new questions, to address it right then in the moment, especially if you're not writing it down and you could potentially forget about it by the time your next appointment comes up. I always tell my patients, please don't wait. Send me a message. And then if it's an emergency, give us a call then, because it can take some time to get to the messages. But reach out and be, there's open dialogue and open communication all of the time.
Right. So this is really important, right? Because sometimes we'll have a visit and let's say we prescribe a medication for a migraine. And after 1 or 2 tries with that medication, either it doesn't make you feel well or it doesn't work. Don't wait until that 3-month appointment to let us know. You can send us a message and we can change course. And by the time you come back for that 3 month, we've already started something new rather than being 3 months behind the 8 ball. And so sometimes it can be a very quick or easy fix where something can be adjusted. Other times it may not be. And the doctor may say, you know what, we need to do another visit to address that. But at least we're not just waiting and saying, well, I'm just going to stop doing this and I'll just wait until we follow up. Right. You can be working towards that new plan without waiting for that follow-up appointment if you use those patient portals and other communication ways, picking up the phone and calling, to communicate with your team. I think that's a really important point as well.
And let me interject.
Absolutely.
The system is complicated for patients.
You're right.
Oftentimes when you say, just call us back, it's not that easy.
This is true.
Like this is a private practice, like I work in a private practice, so they can pick up the phone and speak to my nurse within 5 minutes. And a lot of practices, you can't even get the office. You're speaking to like a central person. And so you need to know how to navigate that as a patient. Like you need to say, I need to speak to my physician's nurse. I have a question, so that you can get routed to the right place and not get discouraged in that quest to get to your physician, because it's not always easy. And I know people just give up. And I guess my point is don't give up.
What I often say is, yes, it can be difficult to navigate, but I will also say that if there's something we want to do, we figure out how to make it work, right? We do research. If we want a new hairstyle, if we want a new car, we're going to learn all the lingo, all the things we need to say when we walk in that door. So it seems like we know what we're talking about. I think also when we want to navigate some system, if we got to call the IRS to get that tax refund, you're going to sit on that phone and you're going to figure out which button to press, right? And so we have to have that same stick-to-itiveness when we are talking about our healthcare, right? Because it's so important. And so just like you research that other stuff, just like you research that new, hairpiece you want or whatever, you need to have that same energy when you are talking about approaching your healthcare. So there are challenges, but we are very good at overcoming challenges when we want to. All right.
That's
so
right.
We got to want to when it comes to our healthcare. And so how do we handle things like delays, right? Or insurance changes, right? So that can be something that can be very difficult to navigate. So what advice can we give folks about handling or kind of dealing with those type of issues when it comes to their healthcare?
I would start off with staying on top of it. If you know that a change is coming to your insurance, make sure that you're submitting that new information. Or if you get an email requesting for you to send in your insurance card, try to actually pay attention and send it in, or be prepared at your next appointment to give that new information. think that's one of the main things that just popped out.
Yeah, that's the first thought that came into my mind. Yeah, for sure.
And the other thing I would say is it's also important to let your team know if maybe you're losing insurance, right? One of the things that I often run into with my patients is that for medications, disease-modifying therapies for MS, there are often programs that can help you get free medication. But if I don't know you don't have insurance and I don't see you for 8 months, I don't know to point you to those resources. So even though we know challenges happen and sometimes we may feel ashamed or feel some kind of way, if you reach out to your healthcare team, there may be resources to help you stay connected, continue with your care, continue your appointments, but we don't know to give those to you unless you reach out to us and let us know what's going on. So I think that that's also extremely important as well. Dr. Poole, how can patients communicate concerns respectfully but effectively when they feel stuck?
Good. That's a good question as well. I don't know about most physicians, but I think we welcome questions. I think they have to be asked at the appropriate time. So if your doctor is in the middle of something that is important and they're trying to kind of get something through to you, that may not be the right time. But once there's that natural pause in the conversation, it is totally safe and okay to say, can you say that differently? Or I really don't understand what you're saying. You can even say, could you print that out in a handout for me so that I can read it at home later? But just asking for more, asking for clarification, because at the end of the day, if they don't understand, they're not going to follow the plan. And so just getting clarity on the plan for your health, just ask, step in and ask the question. We're not offended, but try not to be, offended or defensive when you're asking, but just say, can you give me more clarity on that? I think that phrase will get you far.
And Dr. McEwen, give us a little bit more about the importance of respectful communication.
I think at the end of the day, it's all about, you want to have this good rapport from a patient standpoint and as a physician. You want to be able to make sure that you're comfortable communicating with your doctor, and also that your doctor is comfortable with you. So honesty is one of the biggest things that you can do with making sure that, I guess, the conversations go good and that your provider is able to give you all the information that we can. If we don't know, if you don't bring it up, like you alluded to earlier about insurance, we can't help.
And I think it also is important to remember that it is a therapeutic relationship. And we do want to remain respectful with each other, and also recognize that remaining respectful with your physician also means remaining respectful with the staff at your physician's office. Now, you can't call and go off on Mary and think that we ain't gonna find out that you went off on Mary, okay? So again, right, you said you don't play by the staff, right? So again, we are all one team. It takes all of us to take care. If there are issues or concerns, we absolutely want to address them. If you are not treated correctly, or if there is some type of issue with the process, you can bring it to us and we can address it, okay? But what you need, we don't need you out there with guns blazing, and then on the back end, being nice to us after we heard you just cussed everybody out at the front desk. Right. Okay. So I get amens to that.
Amen.
All right. So let's just make sure we keep it cute. Okay. But certainly we know that people are human. We know that everybody in every office staff is not necessarily on the same page. And so we want to address those concerns, but let's try to make sure we keep it respectful so that we can continue that therapeutic relationship, and that every relationship in the office is related to the relationship that you have with your physician. Yes. All right. So we're winding up here. This has been a good conversation, right? So I think y'all got some nuggets to take home. All right. But we're going to do our lightning round, right? Top of mind answers, one word or one phrase for each of these questions. All right. So I'm going to start with you, Dr. McEwen. What's one question patients should ask but often don't?
Where do we go from here?
I like that. All right. Can you answer that one? What's one question patients should ask but often don't?
I think it's actually the same. What happens if this doesn't work?
What's the next step?
Same vein, but definitely. What's that next step?
Absolutely. Where do we go from here, and what is the next step? One word that describes how patients usually feel walking into a medical appointment.
Vulnerable.
Okay. All right, we'll go to you. What's one sentence patients can practice saying that immediately improves communication?
Can you repeat what you said, because I did not understand?
I like that. What's the biggest myth patients believe about talking to their healthcare team?
That we're like the big bad wolf. we all bleed red, right? So it's fine for you to look me in the eye and ask me whatever questions that you have. It's safe.
Yeah, and I think the other thing is that there's a question that's too personal or vulnerable to ask, or a symptom that people are ashamed. I'm like, honey, if you knew the stuff people told me, people tell me this all the time, right? So don't be ashamed to ask something that's really important to you. We get that with things like sexual dysfunction, particularly with some of our patients. What is one thing patients can do before an appointment to make the visit go better?
Have your list of concerns.
From your side of the exam room, what do clinicians wish patients knew about communication?
That your understanding is just as important as what we do.
I love it. If a patient leaves a visit confused or unheard, what's the next best step?
Reach out, ask questions.
In one word, what does good healthcare communication look like?
Collaborative.
Collaborative. All right. That's Dr. Charnetta's word. Her favorite word is collaborative. Check out our episode about care partners. All right. If patients remember just one thing about communicating with their healthcare team, what should it be?
To be honest.
Oh, yes, absolutely. We need you to be honest, right? Because if you're having issues and it's because you're not taking your medication and you don't tell us, we won't be able to help. Okay, so honesty is extremely important. All right. If patients remember just one thing about communicating with their healthcare team, what should it be?
That we're all on the same team.
Okay, absolutely. We all want you to have the best outcomes. We're working toward the same goal. All right, I love it. Well, thank you all so much. This has been a really, really enlightening, I hope, and helpful episode. Communication is a skill, and just like any skill, it gets better with practice, support, and confidence. Thank you, Dr. Poole, and thank you, Dr. McEwen, for participating in this thoughtful conversation. To our listeners, if this episode helped you, share it with someone. Subscribe to Brain Chat on our YouTube channel and follow us on social media, and follow the Joy Life Foundation to keep up with more patient-centered education. And most importantly, stay curious, ask questions, and take really great care of your brain.